Every year in the United States, about 250,000 people are diagnosed with prostate cancer. However, only about 30,000 men a year die from prostate cancer. It's still a very serious condition, but it's the second most common cause of cancer-related deaths in men. But the ratio of death to incidence of prostate cancer is very low. For each case diagnosed, for every 8 cases diagnosed, only about 1 death will be recorded. Part of the problem with this inaccuracy of prostate biopsy is the nature of the biopsy itself. Ultrasound has been used for the past 30 years to guide prostate biopsy. Ultrasound was introduced in the 1980s, and it was a big advance over what came before. But the trouble with ultrasound is that it doesn't see prostate cancer. It sees the prostate and allows us to systematically biopsy the prostate, but it does not see cancer. Now comes along sophisticated MRI, and many of the prostate cancers, which are destined to be killers, can be seen on sophisticated modern MRI studies. What we have here is a device which allows us to bring MRI into a clinic setting, fuse it with real-time ultrasound, and see where to put the needle. Previously, we did not have this ability, but many prostate cancers can now be seen upon MRI, and through the miracle of image fusion, they can be targeted, biopsied, characterized, and followed. We started this work in the year 2009, shortly after the ARTEMIS device became FDA approved. We were one of the first in the country to obtain this device and have now achieved a large experience with it. More than 1,500 men have undergone targeted prostate biopsy at UCLA. It's proved to be a great advance over what had been available before. We've published a number of studies. We've shown that men with negative prostate biopsies but persistently elevated PSA frequently can be detected and diagnosed appropriately with the ARTEMIS device. We especially like this for men considering active surveillance for what appears to be low-risk prostate cancer. It turns out that not every low-risk prostate cancer is actually low risk, and when MRI and fusion biopsy are applied, we can detect many of these cancers which would not be appropriate for active surveillance. The other side of this coin, of course, is that men who don't have prostate cancer but are suspected of having it can be given a degree of reassurance not possible with conventional biopsy.